Welcome everybody. So today's weekly call, state of vision rehab call, we have devoted to continuing one of our discussions of summer camp programs, and this is devoted to transition age summer camp programs. So if this is a surprise to you, we did take over our weekly call time with a specific topic this week. So I apologize if this is coming to you as a surprise and this is not the topic that you wanted to discuss. However, we have had a lot of demand from those of you who are planning summer programs to continue these conversations, and we wanted to use this time for this topic. So you won't hurt my feelings if I see you drop off because you're like, that's not the topic I want to talk about. But we are itching to connect all of you. Wow, this is great attendance here. Hi, Nancy. So we're again, this is just an opportunity for you to share the challenges that you all are having and any advice on transitions age programs. Of course, tomorrow we will do school age programs on the call. But whoever would like to start us off, please go right ahead. Yes, the topic for today is summer programs, transitions age. So specific to that age group.
Hi, my name is Leslie Hoskins from Leader Dogs for the Blind. I'll start out. We have decided to go virtual with our camp this year, and we are choosing to do the same week that we would have done our on-campus camp, except for doing through Zoom. And we're going to do 2 half-hour sessions each day. And so throughout the week, we're going to have different topics. We're going to do like an indoor scavenger hunt. We're going to do a full day devoted to guide dogs. So we're going to have kind of like go over the International Guide Dog Federation standards, and then have a Q&A with some GDMIs in the afternoon. We're doing a show your best self, which is going to be talking about interview skills, showing your best self in your college application, showing your best self on social media. We're doing a mentor panel with some of our past graduates and others in the field who are doing great things that are visually impaired. So we've got a lot of fun activities that we're doing, and that's how we're choosing to do it. We are sending our campers a box of materials ahead of time that include a couple of craft items, some tactile maps and information and stuff like that, because we're going to do a virtual tour of our campus. And we're doing our camp for ages 14 through 17. So if you have any teens that are interested in learning a little bit more about guide dogs and stuff like that, our application isn't due till June 5th. So if you have any questions about it, I'm happy to share kind of our schedule and what we have lined up for the week. I'm also willing to participate in others' camps. So if you guys are trying to put together a camp and you want to have some guide dog information, I'd be happy to talk about guide dog readiness for teens, or potentially do kind of a mentor panel or a Q&A panel with some of our guide dog mobility instructors, if that's something that anybody is interested in also. So I'll put my email address in the chat, and I'd be happy to collaborate or share any other information, or if anybody has any questions too.
And Leslie, I messaged you, your name is actually displaying as Ben.
I have no idea what that is.
It's a link. It's just a link. I am happy to rename. How do you spell your name?
Leslie, and then Hoskins, Hoskins.
Got it. All right.
Thank you so much. I didn't even notice.
I'm sure it was a link that Ben had shared with you to make sure that you got into today's meeting. Those are awesome ideas. Wow.
We're really excited about it. You know, it's uncharted territory by all means, and it's not going to be nearly as fun as our on-campus camp, but I think it's going to be really fun and interactive. We're going to do a trivia night and, like I said, a craft one of the days. We're also, along with all of that, going to do a private Facebook group, so that we're going to have prompting questions throughout the week and hope to make it still intimate with the campers to kind of get to know each other, because that's one of the best things about camp is making friends and having somebody to call and things like that. So we're hoping to still kind of give those few features to it, and we'll see how it goes.
Very nice, very nice. Who is next? Trying to help somebody get in here. All right. I imagine that a lot of you are also sending materials to campers ahead of time. I have a question here. The one question from Anna Costa. The one question I have is about liability waivers or code of online conduct. Is there anything I should particularly include or articulate? We are doing total online pre-college program. Anyone have anything to say about that?
Hi, this is Nancy Miller from Visions in New York City. Hi. In terms of liability, we actually got some forms from our employment counsel, the lawyer that we consult with on any employment issues. And they have both a screening tool for staff as well as a screening tool for participants that will not eliminate liability, but will reduce liability, because it's basically a self-report that enables us to say, we asked you these questions and you gave us this information. We have chosen not to do any testing or temperature checks ourselves, because the protocol that New York State would have required would have meant that we would have had to have hired a health professional who would be able to keep the results private and have HIPAA protections that we don't have in our facility. We can't afford to hire a healthcare professional to do the testing. But testing is not required in New York State, just a screening questionnaire. But I would also suggest that you check your liability insurance policy, because we reviewed it with our broker to make sure that we had the right kind of coverage. And sometimes you can get a special rider for a short-term program that gives you more protections. It's expensive, but much less expensive than a lawsuit. And brokers are very helpful in helping you figure out what kind of coverage you need for what kind of service. Our State Commission for the Blind asked us to develop both a in-person curriculum and a virtual curriculum for all of our transition programs. So we have spent the last 6 weeks writing up remote curriculum, virtual curriculum for all transition programs, and we have many. But it looks like there is a possibility that where our facility is located in Rockland County in the Mid-Hudson Valley might actually be open for this summer for face-to-face and in-person services. And there have been some very good articles written by doctors working with the COVID-19 pandemic about how to make summer programs safe for children and youth. And I would recommend, there's one in the New Yorker. There's another one that was in the New York Times. If you Google summer camp, actually quite a few articles have given tips to summer programs on how to open face-to-face and when it's safe and when it isn't, and whether it should be overnight or not overnight. And several of the articles have recommended going to family camp as opposed to having the children come on their own. So inviting the parents to come and then housing people or giving program to the family because they're sheltering in place anyway. And so we have always offered a family camp for younger children where the parents come, but we're going to be offering it as well for transition age.
Nancy, this is Lee. Thank you for sharing that. Can I ask you a question?
Sure.
I think some people are probably thinking it. So the guidance that these doctors, the article and the guidance, it's specific to people who are blind and visually impaired?
They've talked about various populations. So in the camping program, some of the articles are about just like these very expensive overnight camps that draw campers from all over the country.
Right.
Connecticut has basically said those camps will not open, and none of the doctors are recommending that you open a camp if the children are traveling from another part of the country.
Mm-hmm.
That is not safe, whether you're disabled or not. Some of the articles talk about, quote, special needs. They're not specific to blindness, but they are covering vulnerable populations or children that might be at greater risk because they have an underlying health condition. So I think you have to pick and choose the articles based on the nature of the population you serve. If the children you serve are only blind and have no other health problem, that's a different set of decisions than if you're serving multi-disabled or children that are blind and also have chronic health conditions.
Yeah, I guess what I'm thinking about more, I mean, the underlying health conditions, of course, is a concern, but also how you can be assured that children who are blind or visually impaired can safely physically distance and wear masks and follow all those rules. Now, I guess if you're considering having their families there with them, then they're the ones who will be responsible for making sure that happens, that they don't bump into people and things like that.
The one article that I remember most vividly, and I've been reading all of them, is one that talked about preschool that actually had a lot of good ideas about how do you keep children away from each other at 3 and 4 years old.
Exactly.
And the exact same guidance that they gave for preschool was directly relevant for blind children, masking, having a location that they know where it is, that it's safe for them to sit or play or pull out their materials, that is kept 6 feet away from the next child. And mostly what they talked about during the summer was doing everything outdoors.
Oh yeah, I think that's a great
it's so much harder to keep children safe in an indoor environment, but if they're outdoors, not only are they less at risk of virus, but you can do activities with them that naturally keep them apart because you have more space.
So I'd love to read that article. Is that something that you can share with us? You don't have to do it right now, but.
Yeah, let me go back because there were several that I thought were just very well written from doctors who've been working in hospitals who have children and their decision of whether or not to send them to summer camp.
Yeah,
So
that's great.
it's both as a professional and as a parent.
Good. Thank you for sharing that.
I just put something in the chat, a reminder that we have set up a private Facebook group for summer programs for you all. You can request to join. It's a great place for you to post different resources and share things with each other, as well as we will have a folder in our Google Drive to keep sharing these resources as well. So anything you want to email me, Nancy, just send it to me.
Okay.
Wendy at visionservealliance.org, and I can post it there. And
I'll see if I can find it while we're still on the call. Otherwise, I'll send it to you after.
okay, great, thank you. I know someone requested if anybody would feel free to share your curriculum. They are developing theirs. So that's also something that would be great. They would be grateful if you share. Oh wow, we're shy today. No one is sharing. This is rare for this group.
So this is Dina from the Carroll Center. Nancy, so are you planning to open your camp in Spring Valley? Or are you still waiting for guidance?
We're counting the days because right now our location is in phase 1, and we
Okay.
will not be allowed to do face-to-face services until phase 2. The guidance says there has to be at least 2 weeks between phase 1 and phase 2, but it could be longer depending on the statistics. So we're getting to the point, we've already canvassed our families to see if we opened, would they come?
Mhm.
And about 75 or 80% said yes. So, you know, if we're allowed to open, we will open for in-person service. But I can't say for sure. You know, we may just be too late. They may open for service at the end of August, in which case it's too late.
Right.
But if they open at the end of June, then we will have in-person services this summer.
Okay. Yeah, I mean, the Carroll Center is still moving forward with in-person summer youth programs. We have decided to take our Computing for College program as a remote, which is typically a 3-week program. So we're just turning it into a remote program. And our program for younger children under 14 is not taking place face-to-face, and we'll be offering some remote topic-specific programming for children, sort of just, you know, like an hour and a half once a day, a couple days a week for a couple of week period. But we are planning to do our youth in transition program for 6 weeks and our real world work experience program for 6 weeks, but they'll operate independent of each other. We only have, I think, about 12 students in each program. So we're heeding to the guidelines in Massachusetts of a certain number in what they call a pod. We're also waiting. Our phase 2 does open June 8th. If the governor, that would be the earliest it opens, unless the governor changes that. So, and like Nancy, we've been communicating with families about their willingness to come, and everybody, for the most part, is willing to come. So unless their state agency says no, and we don't have anybody coming from beyond New England. So it's a day by day kind of decision, and we're putting in plans for kids having their own room, no sharing of rooms, small group, lots of outdoor activity, kind of trying to keep the numbers small, including with the numbers with the staff. No field trips like we used to do, like going to amusement parks and beaches and stuff like that, are not going to happen. I think the kids are pretty much going to stay on campus, with maybe going local to some like local areas for hiking or something. So it will be a very different program if it happens.
Hi, this is Terry from AVRE in Binghamton. I just wanted to make a comment. I find that I'm listening to people in larger areas, so we're a very rural area. Seems people in the in the urban areas are much more excited and much more willing to continue with services than the rural areas. Our people don't even want us coming in. They're like, no, no, no. Now, of course, I'm in New York, but we're in the southern tier. And as I said, it's rural. So I'm just wondering if we can kind of take a tally and see how other people are feeling regarding their consumers. Are they getting feedback that people will allow them back into the homes and, you know, also to summer camps? Or are you getting I wonder if it's an urban versus suburbia rural issue, or I'm just wondering, because I'm starting to feel like I'm the only person who, only agency who's having this problem. And so I'd just like to see if other people are having it as well, if you don't mind me asking.
We're in Tampa at Tampa Lighthouse, and we have the same issue. We did a poll, and they did not want to come, and they didn't want them in transportation. And so we're doing virtual and doing 3 rotations in the morning and 3 rotations in the afternoon. And we're not even in phase 1 yet, because our cases are going up every day, 100 or more a day. So no field trips. We are going to create some work experiences for them to do at home, because the 2 draws, besides being together, were the paid work experiences and the field trips. Field trips are out, and the places where they went for work experiences aren't even open. And so we're going to get creative and set up some things, and hoping that our state will go along with the plan to give them a shorter version of the summer work.
Thank you, Sarah.
But we're definitely virtual.
Thank you.
And the Carroll Center is actually beginning in-home services next week. That was part of phase 1 that we could do. It's just our mobility staff, and it's outdoor lessons. So meeting the client at their door, walking around their community or neighborhood for the most part, or limited just indoor. Everybody has to wear a mask. We do have a questionnaire we created. We're waiting for our board to approve, both for staff to answer on COVID and then the clients to answer on COVID, as Nancy talked about. And we've pretty much, and with PPE requiring masks for lessons, and pretty much have said to our staff, if they feel unsafe or they feel a client is not healthy, then they won't be scheduled for services. So we are kind of starting with the known clients that we stopped working with in March, and starting with those who we know are kind of healthy and need. But the client has to be willing to participate as well. And the staff have been informed that they can schedule a lesson for next week, but they need to call and talk to the client less than 24 hours to ask the COVID questions. And they need to do that for every lesson. So if they see them every Wednesday, then every Tuesday they need to call them to ask the COVID questions.
Yes, Dina, we're doing the same thing, and we're also telling them that, basically everyone in the house has to wear a mask, and, unless you're 2 or under, and making sure that's okay with them before we come out. But I have less than 10% of the people that we work with who are willing to even let us come out.
Yeah, I think our bigger problem is that a lot of the people we work with are in facilities you can't get to. We can't go to group homes. We can't go to assisted living.
Yep.
So that makes up a
You're
big
right.
chunk of our clientele that you can't even try to go to. And we've kind of said to the staff, like, stay away from big senior housing apartment buildings, places. So you do kind of limit the pool of who you can even start to work with.
Terry, I'll chime in. It's Jane Marivola from New Vision. We serve the counties north of Orlando, so we are rural Central Florida up in our area. I've also encountered, I work with preschool all the way up through high school, and we've encountered a lot of resistance, both from the children's families and from the adults that we serve at our CRP. And I want to say about 85% of them still don't feel comfortable. We are in a phase 1 of sorts, and our governor did approve in Florida for youth activities to resume at parents' risk. So if they didn't encourage it per se. But if it's not the kids, we have a lot of kids who have secondary conditions as well. So we're very resistant. We are going to start virtually here in June with all ages. We've been virtual this whole time. And then we'll just kind of assess July as we go, depending on what our numbers look like, or unless the state tells us otherwise. But we also encounter, we have a lot of multi-generational families. So, and the families we've encountered where they're not wanting to wear the mask. I have no problem wearing one. But getting the entire family, when you have a child who lives with 5 or 10 family members, and getting every single one of them to wear a mask, they feel it's their home. Right. When we're going in there, and they have the right to say, no, I don't want to wear one. So we compromised with virtual for now, but we are encountering that in a rural area. We also, transportation wise, it would just be impossible because we don't really have a public transit per se where we could space out 6 feet and or a company van. So so that's so far what we planned.
Thank you, Jane.
No problem.
Okay, this is a self-sustaining group here, so take it away. What other questions do you have? What other things do you have to share?
Hey there.
Hi.
This is Cindy Miller at the San Antonio Lighthouse for the Blind, and I have Daisy Garcia here with me. I hope that you guys can see her. I can't see our feedback. Oh, here we are. There she is. Wave, Daisy. And so Daisy is managing our transition to work youth program. And what we've really done is we've decided that we're just virtual for the summer for all of our children and youth programming, including transition. We didn't send out a poll, but just overall in San Antonio, the feeling is that people are really laying low, continuing to self-isolate, and really taking pretty independent protective measures. Our mayor is also really erring on the side of safety. And so, of course, at the Lighthouse, we also are erring on the side of safety. All of our manufacturing lines are up and running and continue to be so because we're considered essential. And up here in the children's program, we just started back to work on Monday. On Tuesday, because we're so spread out. We're each in a different office. We maintain our distance, and we don't have kids in our classrooms. But we have 2 camps that are tentative to be in person the last week of July. We're not planning anything any earlier than that, and our coaches for that know that it's tentative, that we are just looking at week by week and keeping it safe.
That makes sense.
So that's our plan for now. Do you want to add anything?
Every state is so different, and I'm sorry I was in and out initially, so if you already covered this, I apologize, but since you're being so quiet, I thought I'd just say that it's, it really isn't one size fits all. And even if you decide to, whatever you decide to offer, you may or may not have all of your intended clients want to participate. So if you haven't already done that, asking all of your consumers what their preferences are and doing your best to honor that. I'm curious to know, and again, apologize if you already discussed this, if you have contracts with state agencies, what guidance are they giving you regarding summer programming? Are any of the states pressuring you one way or the other, remotely or in person? I'm seeing a lot of heads shaking no. Cheryl, would you like to share?
They don't care which way, but they are pressing us to do it because of the fact that RSA won't back off on that 15% of the 15% of the funds have to be spent on transition. So they expect us to produce the same hours that we would if we were in person, but they're okay, and they support virtual because they're still virtual themselves.
Yes. Is that I mean, there's only a few of you on video, so shaking your head yes won't help for those of you who are not, but
In
We do have
Massachusetts,
reaction.
they're supporting our decision as long as we're heeding the guidance of our governor
mhm.
and those guidance and implementing the governor and CDC guidelines for protective equipment and social distancing. But they're as they come into phases, they're also allowing people to have groups of 10 or then groups of 25. So that's what we're really looking at for the grouping of students. So, you know, that's, I think what's difficult is also, all the professionals are saying people over 60 are at risk, people with all these health conditions at risk.
Mhm.
So we have to keep reminding our staff that we can only question people about COVID related stuff, and we can't make decisions about who we accept and not accept if they have other health conditions. I mean, we kind of encourage people if they have health conditions not to attend a program.
Right.
But if we would take them before COVID, we kind of can't exclude them from
Mhm.
programs, but we have to kind of be careful. So it's kind of a fine line that
Yeah.
everybody's walking. And the staff themselves are sort of very challenged about coming back and working with
Sure.
clients. So I think that's to me more challenging than
Yeah.
the clients who are like, are they going to come or not come? Because most clients, if they have health issues, they're not coming. You know, or the
Yeah,
families
they're-
are like,
they're-
no, my kid has really severe asthma, I'm not sending them. So I feel like most people are really heeding their own health conditions.
Yeah, that makes sense. And then what about employees who still have children at home with no place to go? And transportation, and I mean, if they take public transportation, I gather it's still an issue in a lot of places. If they depend on public transportation, I guess is what I'm trying to say. Yeah, boy, this is such an interesting time, right?
In New York, the New York State Commission made a distinction, which I've never heard them make before, and I've been CEO for 32 years. They said, we contract with you, we don't regulate you. And therefore, since we don't regulate you, you are not licensed by us, you make your own business decision. And you just, in case there's a problem, you know, you're the one responsible
fault.
for making the decision. They've literally given us no guidance whatsoever, and just said, you know, just like Massachusetts, follow the governor, the CDC, and OSHA.
Yeah.
And just to add to Nancy's comment, we've been meeting with them 1 to 2 times. First we started every week and then it went down to twice a month. But we have, this wasn't just one conversation. This is multiple conversations that we ask and keep getting the same answer.
Yes. Yeah, well, it just fits in with the whole spirit of the pandemic, right? Zero clear guidance. Figure it out yourself. It's the most confusing time that I've lived through.
We do have a question here from Elena Poole, excuse me, Elena. She is asking about the length of sessions, virtual sessions, what you would recommend. She says, generally our summer sessions with kids last 6 hours. Staff have some concerns about how to keep preteens and teens engaged for 6 hours at a time remotely. I would too.
Yeah, we're
So what does everybody else think on time?
That is a good point, especially since they've been stuck on virtual school for the last 3 months. But we're shaking it up every hour, changing the whole, 1 hour we may be doing home management, the next hour we're doing career exploration, and just breaking it up and try to keep it moving.
So at Leader Dog, definitely we're taking that into consideration. Where there's like Zoom fatigue, which is a kind of a new thing that kids are experiencing, and they're overwhelmed by it. So typically our on-campus program would be, 10-hour days. Like we start very early in the morning and it goes all day. But now that we're going virtual, we've limited it quite a bit, and we're only doing 2 half-hour sessions a day that we're asking the kids to commit to. We're expecting that a lot of those sessions will go longer than a half hour, but we're only asking our kids to commit to that half hour so that they can also plan hopefully other summer, fun activities, and recognize that they're probably going to be involved in multiple camps, now that they can go virtual and probably attend more than one at the same time. So we want to, be flexible as we can. It's hard.
Good points.
So, Cheryl, I'm going to ask you again in Florida. I don't know if other states have the same kinds of hour provisions in the contract that Florida does. Are they talking about making that more flexible?
No.
So how in the heck can you do that?
You get very creative. They go back to the fact that RSA has not given them the flexibility. They were flexible with general revenue dollars, but transition is fully federal dollars. And RSA is making them spend the 15% of their funds on transition. And the way they spend it is to contract with all of us. And so they're holding our feet to the fire. And if we drop below the hours, we will face a financial consequence for that. But they have kept all the requirements for how much has to be spent on those pre-ed skills.
Even though kids can't sit there, even though the professionals recommend having kids sit there that long, RSA and Division of Blind Services are going to make you still do that. That's our government at work.
I know it's hard. It's easier with the teens because they are more computer savvy, and we can do an hour with them and then break and then come back and do something totally different. We're going to have speakers come in and try to do things to break it up. What we're struggling with, which is for tomorrow's conversation, is for the little ones, you got to have the parents be there to get them on and to sit with.
Oh God.
And I'm really worried about that. I'm not as worried about the teens, but
That's true.
Mainly interested in what people are doing. But that call you had last week with the senator's aide,
MGM.
they were not in favor of waivers.
No, I understand that. I just and you can still spend that money, but not require hours. Does everybody have hours attached to their contracts for transition?
No.
Yeah, I think Florida is pretty unique. That's Mr. Director Doyle's invention.
Yeah, I was gonna. Who was that said that we contract with you, we don't regulate you, or something like that? Can you send Lee that letter?
Less regulation down here, Cheryl says. Yeah. And we have someone with their hand up, Sharon Payne.
Yes, but before we go there, Wendy, there was just one thing that I wanted to ask, and I already forgot it.
Oh, sorry. You were talking about Doyle and regulation just a moment ago.
Yeah, before that. Anybody using Objective Ed tools for their remote camp? Because I would think that that would be really great. I mean, they have products that are age appropriate, I think through adulthood actually. So if you haven't checked out Objective Ed's curricula and games and those kinds of things, you might consider incorporating that. Okay,
Yes,
back to you, Wendy.
we had several people mention Objective Ed in yesterday's call regarding preschoolers, that they have a Braille game, they have a barnyard game, and these are, I think they're offering free access during this time. So
They are.
definitely check out Objective Ed. I'll put their link in the chat. Okay, Sharon, what's your question? Let's see, Sharon is muted. Sharon Payne had a question. There she is. Go for it, Sharon.
Is that better?
Yes.
Is that better?
Now we hear you.
Okay. So I mostly serve adults. Some of the teens in transition as they come to the summer programs here in Maryland. And I guess my question is at 15%, because no adults have been served face-to-face in Maryland for nearly 2 months. So the 15% almost becomes a moot point unless it's of the monies that were already allotted for adult services. It's going to be a lot easier to do 15% of a 90% or 80% budget, isn't it?
Well, they already have it figured out as they distribute it in the state. But Cheryl?
It's 15% of the VR dollars they get have to be spent in transition. Our older dollars outside of the older blind are general revenue, and they were more flexible on that. The RSA dictates the VR dollars that 15% be spent on transition.
But for this year, it's not 15% of what it was for the past year, because for 2 months our VR clients are not being served face to face at all. Not computers, not mobility. They're having an online counseling group, but otherwise they're not really spending VR dollars. So that's a real interesting question.
It is an interesting
15% of what?
We're serving
15% of what?
We continue to serve VR clients online, and in Florida, they figure out what they're going to give you a year in advance, and they give it to you in monthly allotments. And they haven't figured out where so much is transition and so much is VR. And so there have been some agencies that have suffered financial remedies by not serving the VR numbers because they didn't get the referrals, because VR referrals are down, obviously, with everything else going on. But we have been continuing to serve VR adults and VR kids, but doing it virtual. And they asked the states, all the states asked RSA, could they carry that money over to next year? And that hasn't been answered either, like if they didn't spend it this year. But
one good thing the New York State Commission did is they told us that because we have a 5-year contract with them, that if we don't spend the money this year, we can spend it next year. But there's also state dollars in there.
Yeah.
There's a state match, plus there's an overmatch that the commission has in New York, plus they get the Social Security reimbursement money, which doesn't have the same restrictions. So they can play around a little bit, but it's to our advantage that we have a 5-year contract and that ours is all outcome based. Not only do they not tell us what hours to spend, but they don't pay us until the client has actually achieved the goal. So we don't get any monthly payment. We get paid about 6 to 9 months after the client has actually achieved an outcome.
I was liking everything you said up to that
Until
point.
that.
I want a 5-year contract, and I don't want to be regulated, but I don't want to wait to get paid at the end.
Yeah.
I do have a lot of concern about the state dollars, because I think most of the states are going to have very tight budgets next year. And talking to our commission this morning, you know, most of our children's services are funded through state dollars.
Yeah.
So he said, even if we wanted to run a children's program this summer, he said he doesn't have any money. I mean, the budget hasn't come out, but his anticipation is they will have very little money for children's services next year.
Yeah, I'm afraid it's going to be like that for a decade, not 1 year.
Yeah, I know.
And to that end, I know everybody's been surveyed to death, so I have to think how to gather this information, but we're just starting to think that there may be more assistance we need to pursue nationally for all of our organizations who, especially if you depend on state money, if it's a significant part of your budget, it's just not going to be there. I don't think it's going to be possible for organizations to earn that money, even if you figure out some magical way to do it. Not all your clients are going to want to participate, and I think at best you're looking at 50% of your revenue, and a lot of organizations couldn't withstand that for very long. We need to know that so we can start talking about it at our public policy committee and our national policy collaborative. You know, and it's going to take a while to gather the information that we need. So we better start talking about it now, I think.
Yeah, I was on the phone today, and it's probably, well, I thought it was a Florida issue, but it sounds like Carroll Center has the same issue with Representative Burton's aide. Our session ended March 30th or 31st, but they still have not sent the budget that was approved to the governor. And normally it would go pretty soon afterwards. And then our contracts for children and babies and older blind are all July 1. And the state cannot send the contracts up to be signed because there's not a budget. And the chances we don't have a state sales tax. We don't have a state tax. Our revenues for general revenue come off of sales tax, and they are doing a forecast, and they're way down, obviously, because everybody's been closed. And the governor said that he was going to strike through the budget on even things he really liked. And so I'm very concerned if we're even going to have contracts July 1, and what's it, there's going to be a continued fallout, like you said, Lee, going forward, because Florida already dipped into the reserves, and they can only do that so much. And I don't know.
Yeah, we need to start getting our arms around what's needed and see if we can't get some traction on it. So it's a little off topic here, but I just want you to know that we're interested. Share information on how it's affecting your organization, what you're projecting for the next year or so.
You remember when you were at the agency, how they said we had to stop services at the beginning of a contract because we didn't have any contracts, and
oh yeah,
couldn't serve again? I'm expecting that July 1st.
Yeah. Oh boy. All right, who's got some good news to share?
I think if you're at a university, they need to put supervising through a pandemic in the curriculum. No rule book.
Yeah. Cavernous ambiguity.
Yeah, somebody said it good. It might have been on one of these calls or a Florida call, that we're building the airplane as we go.
That's my
Yeah.
That's my mantra.
That's a Leism. Thank you all for signing up for the Facebook group. I've been seeing a lot of requests, and I'm approving them as soon as they come in. Reminder that our school age conversation for summer programs is tomorrow at 1 o'clock Central Time. I did also put the link. I think a lot of you have already signed up, but it is in the chat to register for that one.
somebody, I think it was Danny, had asked if anybody had curricula they're willing to share. So again, if you're willing to share, we'd love for you to do that. Send it to Wendy at the address and that she has in chat so everyone can see. But also, I'm pretty sure there is curricula already in, if it's not in the information we've already shared and gathered and shared, I believe I saw it on WinTAC. So if you were not on the call last week, the WinTAC, which is the sister organization to OIB TAC, I'll have to look up the address, but I think it might just be WinTAC. Is it wintac.gov?
I'm putting it in the chat right now.
Oh, great.
It's
There's a lot of
wintac.org.
resources on there, and granted, remember, this is for all disabilities, so it's not all specific to working with transition students who are blind or visually impaired, but a lot of it's very appropriate. So if you haven't already taken a look and you're still interested in that kind of information, I strongly encourage you to do that.
In Texas, we have a curriculum that's been around for a very long time. It's called Functional Academic Curriculum for Exceptional Students, and it's an instructional resource that is free. It has a really good section for high school and transition age students, although the sections also include elementary age. When you look at it, it's divided by elementary, middle school, high school, and I think it's high school and transition. It's been a while since I've played with it, but it's a good resource if you don't have anything else. Like I said, it was written a long time ago, but it's still good stuff. It's great lessons, and it's definitely a good springboard for developing your own lessons if you just need a resource. It also has some good assessments that are criterion referenced. So it gives you a way of calculating, like, what is the skill you're looking for and where is your student, so that you can mark progress and track some outcomes that way. Here at the White House in San Antonio, our transition supervisor developed our curriculum packet for transition, and we have units of study. We are not quite ready to publish that, but we have been talking about publishing that as a shared resource. How many units do we have, Daisy? 11 and counting in those units. So that'll take you, if you did a unit a month, that would take you through a year of curriculum. So let me kind of see where we are on that, and I'll report back to the group. But I'm going to post up on the chat the link for FACES, because this is something that I use with teachers all the time when I'm training teachers. And I have people say, oh, but that's old. I'm like, yes, but just because it's old doesn't mean that it's unusable or that you can't get some traction with it.
I am also putting the link for the Google Drive, which we have shared resources there as well for all of these sessions. Yes. So anything that you send me, I will be posting there after the call. Looks like Lee had to jump on another call. She says, please continue sharing with each other and let us know how your organization and programs are doing. We so appreciate your excellent work.
Hi, this is Cynthia Canham from the Mass Association for the Blind. I had quickly posted this in the chat, and it's a little different from what we've been talking about already, but does anyone have any feedback on or suggestions or ideas or plans for restarting one-to-one volunteer programs? we don't really either. We're sort of stuck on how to unfold that safely and across a whole state. But any thoughts that anyone had would be helpful.
Yeah, that's definitely not on our priority list. It's probably be one of the last things we phase back in.
But are you talking about face-to-face volunteer services, right?
Services that traditionally had been face-to-face, yes. And, a handful of folks we've been able to transition to online, now doing grocery drop-off instead of accompanied grocery shopping. But, we're beginning to hear from people about mail and bills and some of that. And, some of it can be moved toward an assistive technology training route, but that's not going to work for everyone. And it is a low priority, and it is something that seems hard to put back in place. And on the other hand, it's one of our bigger programs, and one of the things that more consumers rely on.
Yeah, I would think you almost have to treat it like employees, but also look at what the services are, because I think, again, like you can do the grocery shopping or errands, you could put the mail in the mailbox and have the volunteer get it and do stuff over the phone with the individual. So I think there's kind of ways to kind of social distance the task and kind of prioritize the task. But in terms of going outside a guide to a store with somebody, it's probably not going to happen.
Right. No, that's exactly where we are.
Yeah, with some of our participants, this is Nancy in New York City. If they have a smartphone and they can take a photo of the mail, they do a photo and then they email it to the volunteer, and then the volunteer can read the mail. Everything now is virtual. We don't have any plans to send. We have high school students that normally visit our older blind participants in their home, and we are not planning to restart that for months.
Yeah, I was going to say, I think the bigger issue is the population and where they live and where you're servicing them.
Oh, absolutely. I mean, it's predominantly older blind, but it could be anywhere. It's really across the state, so it could be right in the city, or it could be rural. And I agree. I mean, we don't have any plans for restarting right away, but looking for all the creative ideas about how to meet needs in the meantime. And how not to lose that volunteer core, that has been built.
Uh-oh, we lost her. Well, we are just about out of time. I think you've got all your links. Any questions? Feel free to email me, wendy@visionservealliance.org. Post things in the Facebook group. It's a private group. It's by invite only, so it's just you all. And we'll see you on tomorrow's call as we talk about school age summer programs. Thank you all so much for contributing your great ideas. And we'll see you tomorrow.